everyone. It's Tuesday, January 5th, and this episode is brought to you by Visibly Media, helping businesses communicate strategically, both online and in print. Hi, everyone. I'm Deborah Gardner. Again, welcome to Hospitality Today Live, your host, where real life topics, perspectives, opinions, stories, lessons are shared from my amazing guests that actually work in the hospitality industry. And today, we wanted to start out 2021 on the right foot with a great guest, a great friend of mine, Randy Clark, who is the owner of Efficient Health Solutions. And right at the moment, of course, to start out the new year, we have some technical difficulties. So Randy will pop in and join us as soon as he can. And when he does, we'll be able to answer a lot of questions that are pertaining to health insurance coverage today, especially in the hospitality industry. So, but in the meantime, I want to open up any type of comments, questions from you that are watching, the fans that have really made this show what it is today. After only 19 episodes, over 6,000, actually 7,000 viewers, that is just incredible. So thank you all for being here to help kick off 2021 on a right foot. And so why don't we do this while we're waiting for Randy to pop in, is I'd like to actually share with some information. Actually, I was just reading the PCMA magazine this morning, and I wanted to actually share with you what I was actually to share about. And maybe we can talk about this through the questions that you might have or the chat that you want to have with me right now. And so this is a great opportunity for you and I to have this one-on-one together. And so what I want to do is I want to share the top 10 trends that will shape the hospitality industry in 2021. Now, we know we are going to continue a lot of challenges into the new year. And we're hearing a lot of people that are saying that, oh my gosh, we need to really take a look at what is going on right now. We still have 4 million hospitality people out of work. And I was just reading Northstar's Pulse survey, as a matter of fact, that found a strong majority of the meeting planners, the meeting professionals, actually 71%, intended to resume face-to-face events no later than the second quarter of this year. But that number has dropped to 55%. And of course, the rest were eyeing about, Q3 as possibly when everything's going to come down. The truth is, ladies and gentlemen, we don't know. Everything is going to be based on the vaccine, the confidence of the attendees, of the participants coming back. And also, the other thing that people are not talking about is the budgeting. Are there really going to be some funds after a whole year of not being able to make money in this industry? So we do have a lot of things that we are facing, but taking a look at some trends at least helps us guide us where we need to go. And so I wanted to at least share with you some of those trends, and let's see what you think about them as well. So come on, jump on board with me with any comments, questions. Let me read them, and let's have our conversation together on a one-on-one basis right now. So let me take a look here. I'm going to pop this into the first trend here. Now, these are trends that will probably define our entire year. So we want to take a look at it, but it doesn't mean that we have to follow it completely. We just need to know and be aware of what is being talked about out there, especially since we're not together. So let's take a look, actually. The first one, enhanced hygiene protocols. Now, that is very important, don't you think? Because think about this. We have to really elevate our safety and hygiene protocols, especially when we get face-to-face again. We need to be cognizant to it. We need to follow the rules of what an event has in place. Yes, a lot of us want to be mavericks and say, well, I'm not going to have my mask on, but yet maybe we do need to have it on there. So I really want you to think about how we're going to be faced with the protocols that are actually going to be in place. Let's take a look at the next one. Extended stays. Extended stays are going to be very popular. So you're going to see a lot of stay programs, packages out there that are going to have some discounts around it in order to entice people to get back into the travel mode again. And this is going to definitely help with the tourism that is going to be coming back probably much quicker than meetings and events. So we can watch what the tourism industry is doing that is going to help dictate what the meetings and events are going to do. But no matter what, we're all under the umbrella of the hospitality industry. So if we watch each other and find this out, we're going to be able to dictate what we're going to be doing. Now, I do want to quote Ralph Halster, who is the Global Data Travel and Tourism Analysis. He says, uncertainty is strife, and it may lead to people going all out on one big trip, rather than risking several smaller ones that could actually be canceled. So think about that. That is why extended stays are going to be really popular. And so we're going to have to pay attention to that. And that might be something that we're already planning among our families, because we certainly want to get out of our homes. Another trend that I'd like to bring up is work-friendly rooms. Now, what does that mean? Well, with many travelers opting for longer stays, well, obviously the amenities within the rooms are going to be very important to people. They're going to have to be comfortable. The Wi-Fi is going to have to really work this time, and practical workstations so people can actually do their business away from home. So I totally can see where hotels, Airbnb in particular, really need to step up their game and provide the amenities and ease and comfortableness to help people want to even stay longer. So I believe that's going to be a huge factor. I definitely have to agree with that. The next one, touchless technology. Yes. No longer do people want to be inconvenienced when they have to use a username, a password, going in and out of different types of pages. It needs to be very, very simple. Minimizing the touch points also has to do with the protocol of health and safety. The less we get to touch something, the safer people are going to feel. So think about that. What can you do in the hospitality industry that can provide a touchless customer service entity, even just like what technology is doing? So the primary goal across the travel sector and into the new year has to be that the hotels in particular, as well as airports, venues, restaurants, whatever has to do with the hospitality industry is definitely going to have to be done by mobile apps, QR codes, any other type of check-in, check-out on their own. And so, yes, I believe that we are entering into the do-it-yourself economy. Not the gig economy anymore. It's the do-it-yourself economy. And so we've already learned this, as a matter of fact. Think about this. We've learned this at grocery stores. I mean, I've never actually been trained to actually work at a grocery store, but I feel like I work at a grocery store. I mean, I'm bagging my own groceries. I'm keying in. I mean, for me to remember that bananas is 4, 8, 6, 5, 10, I mean, is absurd, but it's happening. So this is going to actually leak into other areas, including into the hospitality industry. And we have no choice than to actually go that route. So we got to take a good look at that. The next one I see is added flexibility. Now, successful properties, especially in the hotel industry sector, will be the ones that are able to offer guests added flexibility by way of 100% refunds for last minute cancellations. Think about that. That is really interesting. Having a flexible cancellation policy on a hotel website is going to be vital. So we're going to have to think a little bit differently on how we could be a little bit more sensitive in this fact. So that's going to be very important. Now, let me add you one more, because I want to get Randy Clark on here as soon as possible. But this one has to do with increased privacy. In addition to flexibility, travelers will be seeking increased privacy. So if you're at a hotel property, you might have to think about the housekeeping department. How are they going to approach and change over the rooms, or while everybody's out by the pool, or that kind of thing. So we're going to have to take a look at how families and group-friendly villas stays are going to have to be an attraction. Properties in exclusive destinations where travelers can worry less about local restrictions and close encounters with strangers will also become popular. So those are just a few of the trends that I was able to read this morning, and I wanted to share with each and every one of you, because I think it's very important that we need to take a look at those kinds of things. So now I want to actually bring Randy Clark in. As I mentioned, he is the owner of Efficient Health Solutions. And Randy is actually going to share with us a couple things. First of all, he's going to show us the secrets to knowing your health insurance carrier, the options with the major benefits that you need to know about, and understanding your health insurance, how important it is, and how to empower you as an educated consumer. So stay tuned, and we will be right back with Randy Clark. Randy, as a matter of fact, there he is. I want to say thank you. Can you hear me, Randy?
Hi, Deborah.
Hi, welcome, welcome. I know, thanks to technology, we couldn't have you on right away, but you look very damper, and I'm so excited that you are here with us.
On your end, Lisa.
Hey, Deborah,
I think
can you
he's
hear
with
me?
us.
Happy New Year. Can you hear
Happy
me?
New Year to you too. I'm hoping that your volume is a little bit louder so we can all hear you, or stand a little bit closer to your computer.
Very interesting with the technology, because I'm on my phone, but I can't hear you on my phone. So I have Nora's phone. So we got three things happening at once right now.
Well, welcome to live broadcasting, right?
Let me see. I'm going to try something real quick. Okay. I'm going to see if I can put a headset on.
Well, we're glad that you're here, and I know once you get settled there, we're going to take a look at your background and the leadership positions that you've held in the hospitality industry, which I think goes for about 17 or 18 years, with such iconic hotel brands such as the Mandarin Oriental Hotel Group, Four Seasons. I know you've got the background of the MPI Aloha chapter and all that good stuff. As a matter of fact, I know we have our own little Aloha adoption story.
Yep, I'm seeing it. I don't know what it is or why either.
Can you hear me?
I cannot.
Oh my
gosh.
Let's try this. How about now?
That's going to have a delay.
Deborah?
Yes, can you hear me?
A little bit. Try now.
Okay, I can hear you, and you look very good.
So we're having a technology glitch here, so I'm so sorry about that.
Well, we've got your wife, Nora, and we've got Lisa in the background working on it. So as long as you can hear me, I'd say, hey, go ahead and talk away and give everybody a little bit of your background in the hospitality industry.
All right, perfect. I can hear that. So it kind of faded in and out. But yeah, I wanted to. So I was in hospitality in Hawaii for 17 years. I was with iconic brands like Four Seasons, Mandarin Oriental, Starwood Properties. And that experience led me to be able to have the opportunity to volunteer in a leadership role with MPI, the Aloha chapter of MPI. I'm past president. And then I moved to Texas. I had the opportunity to move to Texas in 2017, where I began to work with Connect, which actually gave me some great experience, more different kinds of experience in the hospitality industry. And then from there, I was able to get my health insurance broker's license and have been doing health insurance since 2018, helping hospitality professionals for almost 3 years now. And I also am a global director with Conference Direct. So I still am involved in the industry. I'm involved with Site Texas. I'm past VP of membership for the Site Texas chapter. And so very much involved in the industry for over 20 years and know what people are going through.
Yeah, as a matter of fact, before we get into the in-depth of the health insurance and what you're doing right now for the hospitality industry, I was mentioning before you came on about the North Star Pulse survey about our hospitality industry and how we're going to continue facing challenges within 2021. What is your perspective and what have you been talking to your clients, your peers? What is the temperature out there that you are hearing and discussing with your friends?
It's interesting because what we would like to do, actually, being a hospitality professional, is to continue to move meetings forward. And
sure.
We're looking at doing that. I mean, we're doing the best we can. We see, things happening in different states. For example, Texas just last week, or this week actually, went to 100% occupancy in restaurants. Whereas you look, yeah, I know. And then you look at California, which is, you read the news about California. So everything changes across the country. So, with Site Texas in July, we had an amazing hybrid meeting where we had 45 people in person, but we had over 2,000 hits virtual, people watching that virtual streaming with our Site Texas event in July. And then I was able to go with Connect. I was asked to help them in October, and they had 900 people face to face. And then right after that was MPI, WEC, and also Conference Direct. They met live. And what people say, oh my gosh, all those people that are meeting and together. But I think there were very few, maybe 1 or 2 cases of COVID, because everything that you did, everything that they did was, to protect the people that are there. So there are amazing standards that have been put in place. Safe. I was able to go with my wife to Mexico in July. And the first thing they do is they spray your luggage down. They take your temperature. They disinfect you. And then before you can even go to the resort, they take your temperature again. So everything is safe, masks up. So what I've been hearing is basically everyone's doing their best to move meetings forward. Yeah,
they really are. And there's a mix right now of, like you said, virtual, in person. And I think everybody's just, again, we're all in this together. We're in the same boat. We're trying to figure it out. But I believe I'm hearing people are moving forward. As a matter of fact, I heard that there was actually a total of 60,000 virtual meetment reported by ABC World News the other night. And I know that includes board meetings and things like that. But that's a lot of movement. I think it's good to hear that we're at least moving forward and trying to do the best we can with the health protocols that need to be in place. So thank you so much for that perspective. Now let's talk about what we really are here for, and that is about the health insurance. Now, I'm very lucky as a self-entrepreneur to find someone like yourself, and to know that you specialize in the hospitality industry was even the icing on the cake for me. And I've been just so thrilled with the insurance coverage that I have through you. But our viewers today don't know about your services and and more information about their own health insurance. So I just want them to first of all know, what does a broker do, and how many companies do you represent, and just so they can kind of get a background of what you do and how that relates to the hospitality profession.
So I have to apologize because I'm catching about 50% of what you're saying, but
Well, it's a good thing for replay. So talk to our viewers about, what does a broker do? What is it that you actually do to help the hospitality industry? What does a brokerage firm do?
So basically, thank you for working with me to provide you and your family affordable healthcare insurance, affordable and effective health.
It's the best, I have to say.
What sets me apart from different brokers is the fact that I am a broker and I represent all the top carriers in the country. I'm able to help design a program for people. So let's say that you might have some pre-existing conditions that would allow you in most cases, or wouldn't allow you in most cases, to have insurance normally. So I have carriers that I'm able to connect you with that would get you that coverage. I also have a solution for people that I've helped, not only you, Deborah, but there's other hospitality professionals. Independent meeting planners love this coverage because it features no deductibles for overnight hospital stay. You can choose your own doctors, and when you stay in network, you usually will get a check back in the mail for going to the doctor. And it's fantastic coverage. You can keep it until you turn 65. You can't be denied coverage once you have it. It is fantastic for people. And the best part, it's got lower premiums than almost every other carrier out there, and it's actually more effective.
So a brokerage then takes a look at companies across the board. How many companies maybe do you look at?
How many companies do I work with?
Yeah.
I work
Yes.
with 11 different carriers.
11 different companies. Okay. And you find out.
So a lot of times.
You find out what the person's needs are in order to determine which company to go with.
Of course, yes. So what happens is I'll spend some time on the phone with that person, find out basically what's important is their age, their zip code, where they live, because that makes a difference. I just had someone that I worked with yesterday that they were in the Atlanta area. There's about 3 different counties in one zip code. So, and it really makes a difference from one county to the other. So it made the difference in the premium cost. So I need that information: your date of birth, height and weight, and any medications that the person is taking, just so I can see if because this insurance that I work with mostly is medically underwritten. So there are questions, and you have to be in relatively good health to have this insurance. But once you're approved, like I said, you can keep this insurance until you turn 65. There's no deductibles, outpatient deductibles. So you can go to the doctor or have free an outpatient surgery and have no out-of-pocket costs. And also, I provide a letter for everybody. It says if you stay in network, you take the letter to the doctor. It says you're part of this PHCS PPO network, bill insurance, and they'll have no out-of-pocket costs when they go to the doctor. So it's really great.
So
and what also
go ahead.
No, I was going to say, what sets me apart is from other brokers too. In a lot of cases, a person who's a broker is a captive broker, meaning they work for one insurance carrier and they're trying to sell you that insurance. So
Ah.
if you're working with that person there and that coverage doesn't work for you, then they have no other solutions for you. So with me, I represent the top carriers. If there's something that's medically and doesn't per person, I can find something that's guaranteed issue with and can help them as well.
Well, and that was my question is how does this set you apart from other ones? Because I'm sitting here going, gee, it's like, this is a no brainer. But a lot of people in the hospitality industry don't know that this would be a good idea or go with another one. I mean, making decisions in the healthcare industry when we are not empowered consumers to understand it and to know what's right for us is very important. Do you feel that is the benefit of working with you since you have the hospitality industry background?
Yeah, so that's a great question. Thank you for that. But yes, I have volunteered. I've worked in the hospitality industry in leadership positions. I've volunteered for years with you. I don't know if people know that, but you were the president of the chapter in Arizona when I was MPI chapter, and you kind of took me under your wing. So we met a long time ago, and
Right.
I appreciate that. Here we are here.
I adopted you.
But and what what they go through. I'm. You did adopt me. I didn't want to call you mom because I didn't want to. But
I could be your mom easily.
But a lot of people are. It's so funny because a lot of people are afraid of their insurance. They don't like. I don't know about deductibles. I don't want to about deductibles. And what I do is help them understand. They can call me. It's like a concierge service basically because I've had these years of training. I'm service oriented, and people can call me 24/7. They're not going to reach an 800 number. They're going to reach me, and I'm going to help them with their answer any questions that they have and help them understand it. And that's what I do. If I send a quote, I go over the brochure and say, okay, this is how it works. This is the plan that's going to work for you. I give them options and help them. I discuss it with them and help them understand it. And so it works for them. It's a better fit. It's the best fit for them.
That is a great point that you just made there.
Other hospitality professionals. Which one?
Oh, well, the fact that you have that hospitality instilled in you, that you got that hospitality instilled in you. You actually, know that we all work 24/7, and you've been able to take that into, your new line of work, your new career, which a lot of hospitality people are finding out now that they're in the position of leaving the hospitality industry to go find another job. I hear it all the time. Well, at least I can take my things that I had learned in the hospitality industry and I can take it elsewhere. And that's the beauty of the hospitality industry, is that what we learned there, we can take anywhere. And so when we get an opportunity to work with somebody that is related to something that we need, like the health insurance, like yourself, it's only an added bonus for us.
Right. It's also with, there's so many people right now, independent planners, they have not had the opportunity to have insurance for years. Obamacare, ACA seems to be the only option for many people just because they don't know. They don't know where to look. And I've helped many independent planners with their affordable and effective health insurance coverage. Also with the state of the hospitality industry, there's several colleagues that I worked with for many years on the supplier side that all of a sudden face hotel closings and losing their jobs. And I've helped families. I have one family in particular that I've saved for the avoiding COVID, helped them save over $12,000 a year in premium costs. And that's a lot of money for any family, and that could be going towards something for college tuition. So I would say that was an experience with $12,000. say, but the average is between $5,000 and $7,000 for people avoiding COBRA, which is fantastic.
Right.
And that's what I love to do. I love to be able to provide people with these options, help them save money. I tell them, I'm going to show you. I had surgery. I broke my wrists in September. And with the insurance that I sell most of is called Philadelphia American. And when I broke my wrist, it's called indemnity. And all indemnity means, and you know this, is to make you whole. So all people are afraid of that word, indemnity. This is indemnity insurance. No, indemnity is really good, because what happens is, with the plan, people, if you stay in network, a doctor's visit is about $100. And if you
Right.
pay for a plan that pays $120 to go to the visit, the doctor gets his $100, and there's an excess benefit of $20. Where does that go?
Right.
It goes to you.
Right.
So when I broke my wrist,
Right.
I went to the doctor and I received over $800 in excess benefit checks. Here's one. This is an example of a check that I received from going to the doctor. I'm not saying that it's a good way to make money, but also it's you don't have to worry about meeting a deductible, paying $5,000 out of pocket before your insurance kicks in. You get first dollar benefits, and it pays for you to go to the doctor. Funny story. I was at a board retreat last month and had a customer call me up who wasn't familiar with the insurance, and I've been talking about it and called a couple of times while I was in my board retreat, so I thought it was pretty important. So she said, let me get this straight. You give me a letter to take to the doctor that says bill insurance, so I have no costs when I go to the doctor. And then 10 days later, I'm receiving checks in the mail going to the doctor. She said, is this a Ponzi scheme? I said, no, it's just great insurance. So it's pretty funny. It works.
Well, it's interesting because when I first got into the hospitality industry, I worked for a hotel, and 6 months later, I got fired. And that's a long story in itself. But all I had to rely on was Cobra. Cobra. And you brought it up earlier that that's the first thing that everybody thinks of to go with. And so I'm sitting there thinking that's not the case anymore. But that's the first thing people think of. Why do they do that? And how do they get that mindset that there are other options out there like yours?
There's a lot of that I didn't hear, but when you're asking about Cobra, and I'll just kind of try to go with this, but what Cobra is basically, your employer is paying for half or more of your insurance. So you don't really notice how much is being taken out of your paycheck when you are on your company insurance. And yes, the insurance is great insurance in most cases when you're working for a hotel chain, and so they take care of you. But all of a sudden, when you lose your job and you have Cobra as an option, you look at that and say, oh my gosh, I didn't realize that the company was paying that much for me, and now I have to pay it. But you don't.
Right.
People can, there are options for less expensive options. And then also Obamacare. This is really important, because most people think that during open enrollment that you can only get insurance one time a year. That's in November, December. That's the case with Obamacare or ACA. But if you want, and ACA, I have to say, is not the most affordable option out there. It's becoming very expensive because, basically with insurance, if you go on ACA, the healthy people are paying for the people who are not as healthy, who use the insurance all the time. So with AA, there's high deductibles, and that's what those deductibles, when you have to pay into those, that's where it goes to help pay for the insurance, right? So you have that. And then once you go to a doctor, you stay in network to go to the doctor. And most of the doctors are leaving the HMO network to go to a PPO network because they get paid more, and they get paid more on time than an HMO network. So the myth is you can only get insurance one time a year. That's during open enrollment. you can get insurance, me or the other broker, and receive insurance any time of year. So you can make a switch at any time. And basically, that's what with Cobra. Like I said, I've saved people $12,000 a year. The average is about $5,000 to $7,000 a year that I'm able to save families to avoid that. Your insurance premiums don't much as your house payments. You can find better options out there. It doesn't have to be that expensive.
Yeah. Well, and I'm glad you brought this up because Lisa, who watches the show quite
I hope
a bit,
that answered your question.
she actually says exactly that. That was her question: is does she have to use open enrollment? Because so I'm glad you brought that up because that is always instilled in people's minds. Do they just call their health insurance carrier and say, "Hey, look, I know it's not a once a year thing. I need to work on this now. I know I've done it before," and they keep saying, "Well, you got to wait until November." So how do you work around that, even though you're saying we don't have to wait?
You just basically, it's a conversation. You have that conversation with people and say, you don't have to wait, and just explain it to them, and people are open to it. And once they see the pricing of this insurance for them, then they're very much open to it, especially with no deductibles, and you can keep the insurance. You can't be declined. I was when I left Texas or Hawaii and moved to Texas, and I was with company insurance. I had a $5,000 deductible I had to meet before it happened. I dropped a knife. Had 12 stitches. It cost me $4,000 out of my pocket to get 12 stitches because I had group insurance. So it's not really always the best option for you. And even if you have group insurance with someone, you can change that. You're not forced and you're not committed to that group insurance. You can look around, and there are more affordable options out there for people. So people need to know you can get insurance at any time. You don't have to deduct, like Obamacare for open enrollment. You can get it all throughout the year. And also if you can look for other options tied to your company insurance.
Okay. So everybody out there, remember, make that phone call to your healthcare carrier or to Randy. I recommend Randy, and have that conversation because apparently you're hearing it right here that you don't have to wait until open enrollment. I do want to bring your friend Thomas Harris on here saying you're looking quite damper today, Randy. I have to agree with him. I hope he sees that, Thomas. Well, what else should we know?
I apologize. It's breaking.
Yeah, I know I know it's breaking up. It's almost like you're still in Hawaii across the waters, right? What's going on there in Texas? But we definitely, is there anything else that you think our viewers need to know about health insurance that can actually help save them money right here? I mean, we know that I think what I'm hearing is the biggest competition for the healthcare industry is going to be AI. Artificial intelligence is supposed to become better than our human doctors. Is that in the way of the healthcare system? And if so, is that going to save people money?
You broke up, so I didn't hear that, but a part of it. And basically what's important for people to know is they do have choices. I'm sorry, I didn't hear what you were saying. The insurance that I use, the carrier that I use most of the time is called Philadelphia American, and they are a trendsetter in the industry. They are so much a trendsetter that companies like United Healthcare have designed plans to kind of match this because they were losing so much in the market share to Philadelphia American. And let's face it, people want a brand name. So something like Philadelphia American, most people have never heard of. So they're kind of sketchy about that because they've never heard of it. United Healthcare, most people have heard of that. So United Healthcare was, like I said, losing market share. So they created this plan that just came last month that is very comparable to Philadelphia American. But it's flattery is the best, when someone, what is it? Copying is the best form of flattery. And that's what the major carrier did to this small kind of underdog carrier, because they realized they continue to move forward with trying to find something to match it.
Right. Well, let me reflect back to my other question, and hopefully you can hear this, is artificial intelligence is coming in just like any other technology in any other industry. Do you feel AI is going to replace human doctors?
Oh, artificial intelligence. Is it going to replace doctors? I don't think so. Because again, like the meetings industry, people want to meet face to face. What I have seen is come on strong, and they with Philadelphia American Insurance, Teladoc is complimentary. And most other carriers have a charge for that. There's also now a new component, which is a mental health aspect of Teladoc, that they have discounted plans, and that has become very important in our industry because people losing jobs, they have nowhere to go, they need someone to talk to. So if you can't meet face to face because of COVID and things like that, there are options out there, and Teladoc has become another very important option. But I don't see artificial intelligence as replacing doctors ever.
Well, that's good. That's a good thing. And I'm glad you used the analogy with the face-to-face meetings, because you're right. That's the way the hospitality feels as well. Well, let's have some fun by closing out the show today, because the information you gave gave all of us is definitely a one-on-one basis. I think people need to connect with you to actually, hear what really works for them. But what I want to know is, looking back on the last couple of months, because I know COVID has hit everybody, what is the one thing that you have learned through this whole pandemic thing, you personally? Can you hear me, Randy?
I completely no sound.
Yeah, for the whole pandemic that has happened, what is the one thing that you've learned, you personally? I'm hoping he can hear me on that. If not, can you hear me?
I heard that. So the pandemic, the thing that I've learned is to.
What's the one thing that you have learned?
Is that people do, virtual can replace, we can do this. People want to meet face to face, and they want to be comfortable with someone. They want to, relationships are the biggest thing out there, right? So, and
right.
with my help, that's what you're buying when you work with me as a relationship.
Yeah, very true. Well, we want to thank you so much for being on the show here, because I tell you what, I know this was a challenging one. We're just going to have you back. I'm sure there's going to be a lot of people that will want to contact you too. What is the best way for people to contact you?
It looks like it's being streamed across the bottom there, but
social media wise, what do you think?
Solutions long one, but easier is my phone number, which is 80. You what?
What about social media? Is a good place to meet you on Facebook, Twitter, LinkedIn? I would imagine. Well, I want to thank you anyway, Randy, so much. Stay tuned on the backstage there. We're still having technical difficulties, but we'll have Randy back again. So we'll make sure we'll get you back on here so we can hear all these answers to a lot of these questions that other people have for you too as well. So thank you so much. And I'm just want to say Happy New Year to you, Randy.
Happy New Year to you. Happy New Year, everybody in the hospitality industry. Thank you for watching. And I'm sorry it wasn't as clear and concise as we are used to, but that's what happens. There's always a glitch somewhere, right? and
Oh
we'll
yeah,
move through it. But thank you for this opportunity. I appreciate it very much.
Absolutely, absolutely. Take care. Bye-bye. Well, I hope that you enjoyed the best part of the show, talking about starting out at 2021. But if you'd like to see this conversation again and catch some of the things that Randy was sharing with us, by all means, take a look at the replay on Facebook, LinkedIn, and subscribe to our YouTube channel as well. And any questions, please join us anytime. Just email us at hello@hospitalitytodaylive.com. And we want to thank Visibly Media for sponsoring today's show as well. So let's talk about next Tuesday at the same time. I'd like to introduce you to Cindy Chustek, who is an expert on mental health. Now, I believe that this is going to be a very relevant topic during this pandemic, especially in the hospitality industry, so that we can find out more about ourselves and what we've been going through as well. We need to learn about the symptoms, the behaviors behind it, the solutions, and even the treatments for things like depression, anxiety, and stress. So stay tuned for next Tuesday. We definitely want to talk about this, and I think it needs to be out in the open as much as possible. And what better way to comment and ask questions that maybe even yourself is going through as well. And again, as I mentioned earlier, with over 4 million hospitality peeps out of work still to date, I think that we can really talk about this in the open and help each other out. So I just wanted to again say thank you so much for joining today's show. I'm Deborah Gardner, and from the Hospitality Today family to yours, we wish you a better and brighter new year.